Hey guys, Tony Maritato here, licensed physical therapist, and in today's video I wanted to explain a little bit about each of the imaging options that are available to determine what is causing your shoulder pain. So the most common, kind of across the board, if you schedule a assessment with an orthopedic surgeon, you're probably going to have an x-ray done. So an x-ray simply looks at the bony structures and bony changes that might have been going on that might be contributing to some of the problems that you're having. An x-ray is great for identifying bone fractures, seeing bone spurs, degenerative changes related to the bone itself, not so much the cartilage and certainly not the soft tissue. But most of the time an x-ray is done before you see the orthopedic surgeon. It's done in the office. It's just a couple minutes. It's minimally invasive. And it gives the surgeon some information to kind of combine with your case history, with the symptoms and everything that you've been experiencing. If it's determined that we need more investigation, more in-depth imaging, usually the next step is going to be an MRI. So an MRI uses radio waves and a large magnet to get a better picture of what's going on, and it includes imaging of the soft tissue. So now we can see tendon damage, we can see muscle damage, we can see what's going on with multiple structures, not just the bone as in an X-ray image. The MRI is certainly more expensive, it's more involved. Usually orthopedic surgeons these days will have access to an MRI within the office, but you have the option to choose whether you get the imaging done in the orthopedic's office or in a standalone imaging center or at a local hospital. There is some impact based on different insurance coverage, so you want to talk to your insurance, you want to kind of review what's going to make the most economic sense for you, and ultimately what's going to produce the best image. There is some great research out there talking about different MRI machines that might have better quality imaging, and then if you have the opportunity to get the MRI done at your surgeon's office, if the surgeon is involved, they might be able to better determine what exactly they want to look at, what structures. So an MRI is a really common next step after the X-ray. In some cases, surgeons might choose not to do an MRI, but rather use a CT scan. So a CT scan uses a series of X-rays to put together a more detailed image, more than just a single X-ray. It is better, a CT scan does a better job than an X-ray to look at bony changes and structures. It gives you some more information, but not as detailed and not as well imaged as the MRI. But your surgeon is going to have a reason for choosing whatever imaging they want. Now, moving away from that, the last two that I want to mention, one is an EMG. So the EMG looks at the nerve conduction. It looks at how the nervous system is controlling the muscles, and if there's a problem with the nervous system, the nerves specifically, the EMG will try to determine where that problem is. The EMG is where they put in those little electrodes and they test different areas along the path of the nerve to determine if there's a problem, where the problem is, and how significant the problem is related to the electric system in your body. And then finally, we used to call it exploratory surgery, but an arthroscopic surgery where the surgeon will actually go into the shoulder joint itself. They do the 3 or 4 little incisions. They put the tools in through these tiny holes. They're minimally invasive, but it is an invasive procedure. And what this does, it allows the surgeon to get in there and see with his or her own eyes exactly what's going on within the shoulder. Any of these 5 tests are, pretty common, pretty reasonable to help determine and diagnose what tissue is involved with your shoulder condition, what would be the best course of either therapy or recovery or fixing the problem, and then how we're going to take, your condition, your case to the next level. So guys, if you have any questions, if you are looking for more information, post a comment below this video. If you haven't already subscribed to the channel, please do so. The channel is growing great and I want you to be part of the channel success. But let me know what's going on. I always enjoy reading comments about your shoulder condition. I'll catch you on the next video.